3 months before my graduation from my CRNA program, I found myself in the emergency department. I was at clinical that day. I was scheduled to do a thoracotomy with one of my favorite CRNAs. He had that personality that made you feel welcome. He was bubbly, super energetic. I absolutely love working with him. So that morning I set up my OR, went and grabbed some breakfast real quick and called my bestie to wish her a happy birthday. And then I headed to pre-op to see my preceptor. And I saw him in the hallway coming up to me so happy and enthusiastic. And he was like, "Hey, how was your interview in Miami?" And with the biggest smile, and I couldn't get the words out. I was experiencing expressive aphasia, and I could see his face turn from being so excited to see me to deeply concerned. He quickly sat me down in an empty bay and took my vital signs. They called, not the code, whatever the rescue code is for the hospital, not the code blue, but the other one, whatever it was called for there. And they assessed my vitals, and I could tell they were doing an assessment on me for a stroke. And y'all, in my mind, I'm having a stroke. What's going on? So after doing an MRI, CT, blood work, neuro assessments, everything came back fine. And it came down to I had a panic attack. Now, it didn't look like what I thought a panic attack would look like. When you think, oh, someone's having a panic attack, they're hyperventilating or they're whatever. It presents panic. I was as calm as can be. I did feel a little low energy. I had been traveling, interviewing for jobs because it was the last 3 months of my CRNA program. I was preparing for that next big step, that next big move, finding a job. Everything was coming together. I had just spent the weekend in Miami. I got flown out. So I was super excited. Nothing about me felt like I was panicking, but I think just not really processing all the changes that were happening and still studying and doing long clinical hours and then also putting travel on top of that. I had neglected my self-care practices. During anesthesia school, I picked up yoga, and I've always been someone to live in the gym. But during those times when I was busy taking flights and clinical, my self-care practices went to zero. So after that experience, I started an SSRI that helped bridge me to take me to graduation, got me to my move to Miami, and then I was weaned off by my physician. But it definitely helped me because I was like, at this point, I have 3 months left in my program. I don't want it to happen again. And I'm at the finish line is right there, 3 months left of my program. So I need to take this serious and take care of myself. I think sometimes as healthcare providers, we have a hard time being on the patient side or just accepting that sometimes we need to be taken care of as well. And then also just the stigma that can come along with mental health, and if you're taking a medication or whatever, or if you're seeing a therapist. I grew up with people with mental illness, and I want to get help. I don't care what anybody thinks. However you perceive me, that's your business. What matters is that I'm whole and I'm okay with me. So my advice to my SRNAs is reach out for help. It is a rigorous program. It's challenging. You may experience things you've never experienced in life, and those are normal feelings and experiences we have throughout the program. Don't be afraid to speak up or to seek help. No one's gonna think you're gonna be less of a CRNA or provider if you get some assistance. I had to do it to finish, you know what I mean? You have to do what you have to do. You have to take care of yourself, because if you don't take care of yourself, no one else will. That's my insight for the day. Now go be blessed.